Some nursing homes, hospitals and clinics are putting in place preemptive measures as cases of Mpox are reported in the region. These include engaging vaccine suppliers and tracking travel histories of patients. They are also ensuring there is enough medical supplies and attention when needed. The Methodist Welfare Society's Bethany Nursing Home in Choa Chu Kang says it is currently preparing notices for caregivers and visitors, advising them to stay away if they show any Mpox-related symptoms or if they have recently traveled to affected regions. The home is also checking and restocking its supply of essentials like masks, sanitizers and thermometers. It also has a business contingency plan in place that can be carried out on short notice. Ang Mo Kio Thai Hoa Kwan Hospital also adds that control and prevention is its priority.
Yeah, well, I'd say that infection control and prevention is very important. And even when there isn't a pandemic going on, we still do take stock of all our PPE and things like that. So there would be gloves, surgical masks, and then the general... the PPEs in general, and goggles and so on. So we have kept stock of this, and we are taking stock of this, but at this moment, I don't think there's a need to be panicking.
The Health Ministry sent out a circular to all GP clinics last week saying suspect cases are to be isolated from other patients. Healthcare workers must also wear personal protective equipment when managing such cases. Areas exposed to such cases should also be cleaned with bleach-based disinfectants. Some clinics say they are considering extra precautionary measures, and these include putting up signs reminding patients to declare their travel history, especially to affected countries. Clinics are also ensuring there's an adequate supply of personal protective equipment or PPE on hand.
All the clinics, all the physicians and all the staffs have been trained thanks to COVID in the past 2-3 years. Staffs are very familiar with triaging processes, patient segregations, on and off PPEs when handling suspected cases. And I think all are still fresh in our memories.
If we find the patient meets the suspected case criteria for Mpox, we will then escalate accordingly. And of course, once that happens, we'll give the patient a mask. We will then segregate the patient from other patients and we'll wipe down the area.
Private healthcare provider IHH Healthcare is also stepping up vigilance. Patients visiting its hospitals at Glen Eagles, Mount Elizabeth and Parkway East have to declare any existing symptoms and travel histories. The healthcare group has no supply of the smallpox vaccine, Jynneos, at the moment, but it is engaging with its supplier to procure it when the need arises. The Health Ministry says the vaccine is only for those who are identified as close contacts of confirmed Mpox cases. Now, travel agencies tell CNA that they will advise customers to take necessary precautions, and these include getting travel insurance and observing personal hygiene. They are also asking travelers to report any noticeable body rash to their tour leaders.
As of now, CTC Travel has not experienced any cancellation related to Mpox. While there are few inquiries from our customer expressing their concerns, but we have not seen a significant drop in bookings or cancellation to these countries such as Thailand and Philippines.
More on the disease. Those who contract the Mpox virus might take up to 4 weeks to recover from lesions. Now, the Mpox virus spreads mainly in 3 ways: through close contact by being around an infected person and touching their skin or bodily fluids, by having contact with the sores or rash of an infected person or animal. The virus can also spread to a person when they touch objects or surfaces that are contaminated. Now, health experts say everyone is at risk of contracting Mpox, but those who are immunocompromised are at risk of severe illness if they contract the virus. Young children and the elderly are also at a higher risk, but the outbreak has not greatly affected these groups of people so far. Now, the virus takes an average of 2 weeks to incubate, and after that, the infected person will develop symptoms. And these can show as flu-like symptoms such as fever, body aches, tiredness, and swollen lymph nodes. Blisters will appear 2 to 4 days later.
Normally, these lesions will take up to a month to recover. Scarring may happen just like with chickenpox, which is not caused by a pox virus. But I think chickenpox is something most of us are very familiar with. But in many patients as well, there have been no scarring and the lesions have just faded completely.
Recent findings show that existing treatments are not effective in treating Mpox. Medical experts say the key to prevent scarring is not breaking the blisters. If someone falls severely ill from the virus, they can be put on oxygen or blood pressure support. Anti-inflammatory medications may also be used to treat the symptoms.
So at this point, we don't have, a drug that can really effectively treat Mpox, and supportive care in a hospital, if necessary, is what we have at present. But as I said, supportive care is important and does give better odds of survival.
The more severe and viral strain of Mpox, called Clade 1MB, originated in the African continent. The Philippines, Thailand, and Pakistan have recorded 1 case each. The Health Ministry says it will offer vaccines to those who have come in close contact with existing cases, but it doesn't recommend a population-wide vaccination strategy for now.